5 reasons why you don't want to get a dental implant. Look, dental implants are great. They could potentially last for a lifetime. Let's say you're missing a tooth, you get a dental implant and you're really happy with it, but there are situations in which you do not want to get one. The first reason is that dental implants are expensive. If you can't afford a dental implant, you shouldn't be getting one, especially if there's other more important things to do in your mouth. And as a practicing dentist, I always like to do this for people when we're planning a dental implant. I don't like to just go ahead and do the dental implant right away. I always like to do what is most important first, and a lot of times that's not doing the dental implant. I always plan dental implants usually as the last option or the last thing that we're going to do in your treatment plan, and I'll give you an example. Let's say you come in and you have 5 cavities and you need 2 crowns and 1 dental implant. If that dental implant is in the back of your mouth, it is the most expensive thing, and it's not only going to drain your insurance when you do that dental implant, but it could drain your bank account, and if you can't afford to do the fillings after, I would not recommend doing the dental implant. Or at least do the dental implant in another year where you're not wasting all of your money up front so you can get the more important things done. Now, if all you need is a dental implant and you're going to go into financial debt over it and you have to leverage your car, your house, and your dog to get a dental implant, and let's say that's the only thing you need is just 1 implant, I wouldn't recommend doing that. I wouldn't finance it out to the max. There are a lot of financing options in the dental industry, a lot of which are really, really penalty heavy if you miss just 1 payment, especially if you're financing that option out many, many years. So if you can't afford the dental implant, I would not recommend doing that. The second reason, I see this all the time, is doing a dental implant that doesn't do anything for you. It should absolutely change your smile, change your bite, change your life. But if you're getting a dental implant just to get a dental implant, or your doctor is really pushing you to get one, it may not be the best option and you may think twice about getting. Here's an example I see a lot. Doing dental implants on sites that don't really need them. For example, on your very, very far back tooth, this would be your second molar. So like if you didn't have your wisdom teeth, your very far back molar, if you have all the rest of your teeth, is called your second molar. Now this second molar is doing a majority of the heavy, heavy biting in your mouth, and it has a very, very strong bite. And there is not a lot of room back there. So a lot of times there is not even room to do a dental implant in the first place. So if you lose that tooth, it's not the end of the world just to leave it as a missing tooth, especially if it's not biting on the bottom tooth. Let's say this is your second molar, this is on your top tooth, so this would be your very, very far upper left or upper right back tooth, and your lower tooth isn't biting on it that much, and you miss this tooth. Let's say you're only biting on it 10% with the surface area of your lower tooth. Getting a dental implant is not critical, and you a lot of times don't even need one. Many patients that I have don't do the dental implant and this site because they don't need it, and it's not giving them a very good bang for their buck. So they're not getting a lot of cost dollar value. They're not getting a lot of value out of it based on the dollar value that it costs, because dental implants are just very, very expensive. Another thing is I've seen a lot of patients come from other offices in my own office, and they are proposing doing these dental implants that aren't even going to work in the first place. And what I mean by that is that the dental implants aren't planned properly. It's just doing an implant just to do an implant. And here's an example. If you do a dental implant on a site that has a very collapsed bite, let's say you are missing all of your back molars and your bite is collapsed and your gums are really close to each other, doing a dental implant in that site is not going to do anything for 2 reasons. Number one, there's not enough room to do a dental implant because the crown needs to have several millimeters to actually have clearance to actually come out of the gums, and you can't even fit a crown in there, number one. And number two, it's just going to be biting on your gum. Who wants a dental implant that is biting on your gum? You don't want to be mashing food on gum. You want a tooth to tooth, implant to tooth, or implant to implant, or tooth to tooth contact. You don't want an implant that is doing nothing for you. Another reason that you may not want to do a dental implant is because you have a lot of risk factors for implant failure. Now, there's a lot of known risk factors for implant failure. Plus, there is a certain percentage, it's small, but we don't even know why a lot of these implant fails. So I've had implants that are placed on a perfectly healthy patient and they fail, and I've had implants that I placed on somebody who has all these risk factors like diabetes and smoking, and I warn them it may not work, and those ones are okay, and sometimes the healthy patient where the implant should work doesn't work. So I'll give you an example of when you may want to reconsider this. It's basically like stacking the odds against you. If you have certain risk factors, you have a certain percentage of risk of that implant failing. Now, the problem with an implant failing is that there is a cost associated with it, and I'm always put in a really weird position. I generally, this is just my opinion, I don't charge people. If I put an implant in and it doesn't work, I just back it out for free. But not all surgeons and not all general dentists are going to do that. They're not going to be as generous with the finances. They're going to charge you to take that thing out. So it's a good conversation to have, just so you as a patient watching this YouTube video are fully informed of the costs and the risks of an implant failing. Now, what does it mean if an implant fails? Basically, we put the implant in, If it lasts the first month, statistically, it's probably going to last the rest of your life once we put the crown on it. Not always, but that is a general rule that I have. So what it feels like when you have an implant failing, we put the implant in and it hurts the next day. Bone in the gum just doesn't grab onto the dental implant and it doesn't take hold of it and it hurts. And it hurts because there's inflammation, there's blood cells, there's all sorts of this inflammation you have in your gum and your bone that is just rejecting that implant. It's trying to get it out of your body. It's trying to inflame it out of the body, and that hurts. There is a lot of pain involved with that. Also, when we take off the cover screw and we're putting your dental implant onto the actual proper implant, that can be very painful. That means a sign that maybe your dental implant is failing. So when the implants fail, there is cost associated. That's the only reason why we're worried about implants failing in the first place. Now in my office, if I place an implant and it fails, I'm just taking it out. I'll refund your money for another thing like a dental implant, or we'll try another dental implant, or we'll try a dental bridge, but I don't charge you. But not all people are like that. That's probably the only reason why you would be so worried about this from happening in the first place. Okay, risk factors. There are known risk factors that cause dental implant failure. And what you're basically doing is if you have 3 or 4 or 5 of these, you're stacking up the odds so that it is not worth getting an implant for you. And I would definitely not recommend them. I won't even do implants on patients that have a higher chance of, let's say, 30, 40, 50% of that implant failure that we know of. I won't even do it. I don't want my work to fail, and no dentist or oral surgeon wants their implants to fail. You place the implant and it fails, doesn't really feel good to you, and then financially, what do you do for the patient? So here are some of the risk factors. Number one, the most common one and the most known risk factor, this is well documented, is smoking. And this is just strictly nicotine use, okay? This is cigars, cigarettes, there's some vaping that has some nicotine in it, and tobacco use is known failure of implants. So, and of course, the more you smoke and the more nicotine that you have circulating around in your body, the higher likely you have of your implant failure. So if you're a heavy smoker, that's just one risk factor. Diabetes is another one, especially uncontrolled diabetes, because we don't know what your body is going to do. Diabetes is very serious because it inhibits your body from healing correctly. And when you're not healing correctly, you're just not going to hold on to that implant. So it's basically it's not a no-go if you have diabetes. It's just a simple risk factor, just that you should be aware of. Let's say you have you're smoking and you have diabetes. Those are 2 risk factors. Now let's say you add another one, which is poor oral hygiene. It's another known risk factor. If you don't floss your implant, it is going to fail. You can get peri-implantitis, which is a fancy word for your implant getting an infection or bacteria underneath the implant into the gums, and then that slowly erodes that gum and that bone, and you can get inflammation in that area, and that causes your dental implant to fail. Now, if that happens, it's just because maybe you weren't brushing and flossing or keeping up with it. Now, the dental implants cannot get cavities, but they can get infections if you don't go in, and especially if you don't go into your dentist to get these things clean. Just because you have a dental implant doesn't mean that it's good for life and you never have to maintain it. Just like buying a brand new car, you have to put oil in it, you have to check the tire pressure, but just because it's new doesn't mean it's gonna last you forever. I mean, no appliance lasts you forever anyways, especially post-pandemic. Those things only last a few years in my experience anyways. Same thing with your dental implant. If you don't clean it and you don't floss it properly, it is going to fail. The 4th reason why you shouldn't get a dental implant, or you should strongly consider not getting a dental implant, is getting one in another country and assuming that a dental implant in the United States is the same dental implant done in another country. This would be like going to Mexico just because it's the closest country and it's really easy to travel across the border and get a dental implant for much, much cheaper than you can get it in the United States. Going to Turkey, a lot of residents of the UK are going to Turkey and getting their dental implants done, and it is just really hard to see, because yes, you are saving money, but don't believe and don't be fooled that a dental implant done in the United States with all the rules and all the regulation and all the training and all the money we put into it as dentists, as practitioners, is the same as getting it done in Mexico, for a couple different reasons. When we do a dental implant, you're paying me a lot of money as a dentist, and this is one of the reasons why dental implants are so expensive, is you're paying me to maintain it for you and make sure and follow through on that dental implant, potentially for life. If you're a patient of mine and I do a dental implant, I'm watching that implant, I'm having you come back, I'm watching for infections. If there's a problem, I'm taking it out for free. This is just something not all dentists do, but I just take it out for free. And I take care of you basically. So I'm in it with you for life. I'm looking at that implant every time you come in. I'm looking at your x-rays, and we are like a team working together. And that's another reason why dental implants are so expensive in the United States. You don't get that outside the United States, and you do get what you pay for. I've seen a lot of horror stories of people who've gone to Mexico, they've had just massive infections, and those could be potentially life-threatening. A lot of people don't realize the situation of what a dental implant infection is like and how much it hurts, and basically we have to take that out. It's also a liability. If you have a dental implant done in Turkey, you ask me to take it out, I may refuse to see you if you're not a patient of record, or I don't know you. If I don't know you and the first thing you ask me to do is take out an implant that's infected, I can give you emergency care, but I don't know if liability wise I am wanting to actually replace that implant or actually touch that bone. I don't know what type of implant they use, what type of irrigation they've used. Did they use antibiotics? The protocol, everything is just so different that getting an implant done is a huge risky move. Yes, you save money, but it is not the same as a one-to-one comparison. It's not the same as getting a dental implant in the United States. So just be a little bit cautious when you believe that you can go to Turkey and get one done for $1,000 where it costs $5,000 in the United States. Which goes back to number one, if you can't afford the implant, don't get the implant, don't put yourself into debt, but also don't go into another country and just get a bunch of implants, especially if there's a lot of implants that you need. If you go to a foreign country like Turkey and you get like 6 or 8 or 10 implants, the risks are just stacking up and up and up and up. And in dentistry, I'm always about risk tolerance and how much risk do I want to take with this patient. I will refer to a specialist if it's a high risk thing to do, but I would definitely not go to a foreign country and just get all this dental work done just because it's a buy one, get one free or buy one, get one half off deal. I've had a lot of patients go down to Mexico and get dental work done. They'll go down with 4 crowns, they'll come back with 7. And I'm like, why did you do that? Why did you get more crowns than even I diagnosed? I'm trying to give you the least amount of crowns possible. And the answer is, well, it was cheap and I was there and I just decided I'm gonna get more, and I believe the dentist. Now I'm having a lot of these patients that have redo crown work, and some of these crowns are done so badly, they actually need to be taken out and a dental implant needs to be put in there. Really hard story when you need 4 crowns, you go down to Mexico, get 7, your teeth are hurting, and you need a $5,000 implant because of it. Doesn't really save much money in the long term. And the last reason why I would definitely not recommend getting a dental implant is because there is a better alternative that is maybe cheaper, maybe faster, maybe better, more conservative, and your insurance is going to pay for it. Not all dental insurances cover dental implants, so be careful. And they also have this thing called a missing tooth clause. Dental insurance companies are a little bit tricky, and the fact that you sign up with them, a lot of times you have a year waiting period, so don't get an implant during that year until you're well established and you actually know what they're going to cover. You can get a pre-authorization that sometimes that helps with some of these big high-ticket items like a dental implant, but be careful that you don't have a missing tooth clause. What is a missing tooth clause? Is basically an insurance company doesn't want to pay for you needing a dental implant if you came to the insurance company already missing the tooth. So let's say you're with insurance company A, and you have a tooth and it needs to be pulled out, and you pull it out and it covers the pulling out of the tooth, but you go to insurance company B, especially if you're new to them and you want a dental implant, they're not going to cover it because the missing tooth happened before is a pre-existing clause. So just a couple things to be careful. It's going to save you a lot of money and a lot of heartache. I know patients have learned this the wrong way, but your dental office, use them and the receptionist to look at the insurance, do a pre-authorization, and just kind of plan so that you're not making mistake number one of doing a dental implant where you can't afford it. The most tragic thing that I see is that people do implants or they do Invisalign while they have insurance, and then they quit their jobs and then they stop paying for those procedures. So also don't make that mistake. That's going to save you a ton of money in the long term. But let me get back to my point number 5. Do not get a dental implant if there's a better alternative. Okay, this is the best example I can give you is that you're missing a tooth. Let's say it's a back molar and you have 2 adjacent teeth that have crowns on them or need dental crowns. Get a dental bridge because that's going to be a cheaper option for you, a faster option for you, and it's going to serve in the function in the way just like a dental implant is. The only thing that's going to be different is that when you floss, you have to floss underneath the bridge. You can't just floss straight up and down. That's probably gonna be the biggest annoyance to you or biggest disadvantage of doing that over a dental implant. But implants are very expensive and it's just replacing 1 tooth. So if you need to replace the 2 teeth that are on either side of that dental implant, please use the alternative that is a much clearer choice. Don't do the dental implant just because you want to do the dental implant or just because you're a dentist or your oral surgeon or whoever wants to do the implant, because let's just be honest, it costs more money for you to get a dental implant than it is a dental bridge. And a lot of people are just looking for what is best, maybe not necessarily what is best for you. I always have an honest conversation with my patients. Here is what you can do. You can absolutely, if you really want to get a dental implant, I can do this, but this alternative, if it was me and my mouth or you are a family member of mine, I would do a bridge because you have to do the cost of getting those 2 crowns. So if you do a dental implant, you're doing the dental implant plus the cost of those 2 crowns and things just get very expensive. So if there's a clear alternative, let's say you have a bunch of risk factors for needing a dental implant, and doing a dental bridge just bypasses those. If you do a dental bridge, I don't care if you smoke, uncontrolled diabetes, none of those risk factors even make a hoot of a difference at all. So if you're thinking about getting a dental implant and you have two sites that are prime for bridge, just do a dental bridge. Also, doing a dental implant in a site that is risky, you have a lot of these risk factors, and you don't have enough bone, and your sinus is getting close, or worst case scenario, you're close to nicking your nerve. Now, this is called the IA, inferior alveolar nerve, and it is a #1 threat of doing dental implants, and is just one thing that I'm most scared of placing implants on lower teeth, is nicking that nerve or even coming close to it, because they can give you altered perception of your face. It can cause numbness of the face. It can sometimes cause neuralgia or pain, and you don't even want to go there. I don't want to go there with patients, and I definitely don't want you as somebody who watches my YouTube channels. And there you go, 5 reasons why a dental implant may not be the best thing for you, and you might want to consider doing something else. I'm glad you enjoyed watching this video all the way to the end. Write a comment. If you made it this far, I would love to know how many people actually made this far in this video, or if you had a dental implant done and you regret it, I would love to know. I would read all these comments, and I thank you for watching again. I'm just a dentist.